One of the key applications from the science of measuring quality of care is public reporting. Publicly available websites that display performance information about providers' quality of care. These websites are often referred to as consumer report cards. They typically apply scientific methods for comparing providers' quality of care and make the results of the comparisons broadly available to the public. The primary purpose of these report cards is twofold. One is to support consumers' decision-making for choosing healthcare providers. That is, they enable consumers to obtain and compare performance information from multiple providers for a given clinical condition or procedure. Indeed, consumer report cards have been a significant development for the U.S., where historically there has been a lack of quality-related information about providers. In the past, when seeking a healthcare provider, people would typically rely on recommendations from a family physician, relatives, or friends. While this information could be of value, it would also be largely based on opinions, anecdotes, and secondhand information. Consumer report cards are intended to promote transparency of providers' quality of care based on reliable and valid quality measures. However, for the most part, you will not find in these report cards explicit recommendations for one provider versus another. The information offered is to support consumer decision-making rather than direct consumers to certain providers. Another purpose is to motivate providers to improve their own quality. Through public reporting, the report cards create incentives for providers to compete for patients based on their quality performance. The assumption is that patients will use the report cards to guide their decisions in choosing providers. Thus, better performing providers, based on their report card scores, will attract more patients. As such, consumer report cards have the potential to improve quality of care by changing the behavior of providers as well as patients. Today, many consumer report cards exist. There is no official report card for consumers. The U.S. federal government has developed report cards regarding several types of providers, including hospitals and nursing homes that participate in the Medicare program, the government health insurance program that covers people aged 65 and over. Many states have developed their own report cards. New York State has been a pioneer in developing report cards regarding providers of cardiac care. Nonprofit organizations at the state or regional level have also produced report cards. For example, the Massachusetts Health Quality Partners, a collaboration of health plans and providers, produces a report card regarding physician practices in Massachusetts. In addition, some companies, namely Healthgrades, have developed provider report cards and ratings as a business activity. The magazine U.S. News & World Report produces rankings of the top hospitals in the U.S. Consumer Reports also rates U.S. hospitals. So while report cards are intended to support consumer decision-making, consumers also have choices about which report cards they want to rely on for guidance. The various report cards and rankings differ to some degree in terms of the providers and measures covered. They also rely on somewhat different methods and data sources. This can and does lead to inconsistent results among report cards. Providers who score well on one report card will not always score well on other report cards. Similarly, some providers will be highly ranked in one report, but not highly ranked in other reports. There's really no government oversight of consumer report cards. Organizations, whether nonprofit or investor-owned, can produce and display report cards without meeting any regulatory requirements. The National Quality Forum, a nonprofit organization, does endorse quality measures, but there are no legal requirements that report cards display only endorsed measures. Consumer report cards have also received criticism from some quality experts who contend that report cards often include quality measures that are not sufficiently reliable or valid. Claims have also been made that some report cards display information that is factually inaccurate. After seeing this lesson, how do you feel about consumer report cards for quality of care? Are you comfortable with an open environment for producing report cards, or would you like to see more government oversight?